Hey everyone, and welcome to The Explainer. Today we're taking a really comprehensive clinical guide on lung cancer and basically transforming it into a clear, easy-to-follow roadmap. Our goal here is to completely demystify what is, frankly, one of the world's most common and complex diseases. So whether you're a student, a caregiver, or just someone who's super curious about the science of the human body, this whole breakdown is designed to give you absolute clarity.
To get us there, we're going to follow this specific roadmap. First, the anatomy of lung cancer. Second, causes and cancer types. Third, symptoms, diagnosis, and staging. Fourth, modern medical treatment options. Fifth, rehabilitation and supportive care. And finally, number 6, prevention, screening, and hope.
Okay, let's dive right into Section 1, Anatomy of Lung Cancer, where we'll look at the actual biological mechanics.
To really wrap your head around lung cancer, I want you to picture your respiratory system as this beautiful, upside-down tree sitting right inside your chest. The trachea, or your windpipe, is the main trunk. This trunk then splits off into branches called bronchi, which divide into even smaller little twigs known as bronchioles. And finally, at the very ends of all these twigs, you have the leaves. These are tiny air sacs called alveoli, and that is exactly where the life-giving magic of oxygen exchange actually happens. So when we talk about lung cancer, we're talking about abnormal cells forming a physical mass, a tumor, that literally blocks, crushes, or destroys these delicate branches and leaves, completely messing up your body's basic ability to breathe.
So how exactly does this vital tree get damaged at a microscopic level? Let's move over to Section 2, Causes and Cancer Types.
You can think of this progression as a 6-step cellular threat. It's literally like a cascading mechanical failure. It almost always kicks off with Step 1, exposure to some kind of carcinogen, stuff like cigarette smoke, invisible radon gas, or asbestos. This toxic exposure leads straight to Step 2, which is physical damage to the DNA inside your lung cells. Because those internal instructions are now broken, Step 3 triggers, and the cells just start to multiply uncontrollably. That buildup leads to Step 4, forming a tumor. If nobody catches it and stops it, the cancer pushes into Step 5, local invasion of nearby tissues. And finally, the worst-case scenario, Step 6, metastasis. That's where rogue cancer cells actually use the lymphatic system to travel and spread to distant organs, like the brain, liver, or bones.
And that brings up a really fundamental truth that a lot of people just don't realize. Lung cancer isn't just one single disease. It's broadly categorized into 2 main buckets, and it's a stark, undeniable split. A massive 85% of all cases are non-small cell lung cancer, while the remaining 15% are small cell lung cancer.
Identifying exactly which of these 2 types a patient has is absolutely crucial because, well, they behave entirely differently. First, we have non-small cell lung cancer, or NSCLC. This type tends to grow and spread a bit more slowly, and it includes subtypes like adenocarcinoma, squamous, and large cell, with adenocarcinoma actually being the most common type overall. Then, on the flip side, we have small cell lung cancer. This one is a completely different beast. It's highly aggressive, spreads incredibly quickly, and is almost exclusively linked to heavy smoking. The type the patient has literally dictates the entire medical battle plan.
Now, before we go any further, we absolutely have to bust a huge myth. There's this lingering stigma that only smokers get lung cancer. But the scientific fact is that while smoking is unequivocally the leading cause, anyone with lungs can get lung cancer. Things like genetic mutations, invisible radon gas trapped in homes, occupational chemicals, and passive secondhand smoke put non-smokers at significant risk too. It's so important that we approach this disease armed with facts, not just outdated assumptions.
So now that we understand those silent microscopic changes, how do they actually show up in the real world? This brings us to Section 3, Symptoms, Diagnosis, and Staging.
The absolute trickiest part about lung cancer is that in its earliest stages, it usually has 0 symptoms. It completely hides. By the time someone actually feels sick, the tumor has usually already grown. You're generally looking for red flags like a persistent cough that hangs around for more than 3 weeks, totally unexplained weight loss, or lingering chest pain. But please keep an eye out for emergency warning signs, coughing up large amounts of blood, which is called hemoptysis, severe shortness of breath, or sudden confusion. Those mean you need to get urgent medical care right away.
So what's the actual game plan when a doctor spots one of those red flags? They follow a very strict timeline. It starts off pretty simple, usually with a standard medical exam and a basic chest x-ray. But if they see a suspicious shadow, things escalate to high-resolution imaging. They'll use a CT scan to pinpoint the tumor's exact size, or a PET scan to check if it's spread anywhere else. Finally, to definitively prove that it's cancer, they absolutely need a tissue sample.
This means doing a biopsy, which is often done through a bronchoscopy. That's where they guide a tiny camera right down the airway to sample the tumor directly.
Once the lab has that tiny piece of tissue, they do something honestly incredible, called molecular testing. They analyze the tumor's DNA to hunt for specific genetic mutations, which go by names like EGFR, ALK, ROS1, or KRAS. And why this matters is absolutely huge. If a patient's tumor has one of these specific mutations, doctors can literally bypass standard broad-spectrum chemotherapy and prescribe highly targeted, personalized drugs. These drugs act like a heat-seeking missile designed to destroy that exact mutation.
Now, you've probably heard of staging. This TNM staging system can feel super intimidating to patients, but it cleanly maps out the severity of the disease. Doctors categorize the cancer from stage 1, where it's very small and completely confined to the lung, all the way up to stage 4, where it's unfortunately spread to distant organs. This matrix isn't just an arbitrary label, it's the exact blueprint used to figure out a patient's prognosis and build their specific treatment path.
And speaking of that path, let's transition into Section 4, Modern Medical Treatment Options. The clinical solutions available today are pretty mind-blowing once a patient is staged.
We've got a whole modern oncology arsenal now, and it's incredibly multifaceted. For early stages, surgery is usually the go-to. The most common procedure is a lobectomy, where they remove an entire section or lobe of the lung. Then we have radiation therapy to precisely burn away cancer cells. And of course, traditional chemotherapy, using drugs like cisplatin or paclitaxel. Plus, as we just talked about, targeted therapies like osimertinib exist for those specific genetic mutations which effectively shut down the cancer's growth signals.
But honestly, the real game changer right now is immunotherapy. You see, cancer is incredibly clever. It actually wears this microscopic disguise, so your body's immune system just ignores it. Immunotherapy drugs, like pembrolizumab or nivolumab, basically strip away that disguise. This is a revolutionary approach because it doesn't poison the tumor like chemo does. Instead, it turns your body's own natural defenses into a highly effective cancer-fighting weapon.
Okay, but treating the cancer itself is really only half the battle. Let's pivot in Section 5, Rehabilitation and Supportive Care, to focus on human resilience and how patients can actively take charge.
You know, you might hear a question like, can physical therapy actually help during cancer recovery? And think, wait, isn't physical therapy for like a torn ACL? Actually, shifting the focus to pulmonary rehabilitation is one of the single most vital ways a patient can actively participate in their own healing.
Turns out, the answer is absolutely yes. Heavy medical treatments take a massive toll on the body and the lungs, but specific physiotherapy techniques fight back. Practices like diaphragmatic breathing and the huff-cough technique help clear out airways and restore lung function. And things like early mobilization and strength training aren't just about general fitness. They are rigorously proven to restore functional independence, drastically boost exercise tolerance, and combat that absolutely debilitating fatigue that comes with chemotherapy. And alongside movement, we have to talk about fuel. Cancer and its intense treatments often cause severe weight and muscle loss, which is clinically known as cachexia. Optimizing a patient's nutrition with a high-protein, high-calorie diet is quite literally just as important as the medicine itself. When you combine that with palliative care, which is entirely focused on pain relief and symptom control, patients are supported holistically, as real people, not just treated as a diagnosis.
Which brings us to the final, and frankly, the most empowering chapter today. Section 6, Prevention, Screening, and Hope.
Look, prevention is hands down your best defense. Stopping smoking, getting a kit to test your home for radon, and avoiding pollution are crucial first steps. But the massive breakthrough I really want you to take away today is the annual low-dose CT screening. For eligible high-risk folks, usually older adults with a heavy smoking history, getting this quick, completely painless scan every year can catch a tumor at stage 1. That's when it is highly treatable long before any of those tricky symptoms ever show up.
I want to share a quote directly from the clinical guide that really hits the nail on the head. Lung cancer is a serious but increasingly treatable disease, especially when detected early. Getting a diagnosis today is simply not what it was 20 years ago. Modern oncology, targeted therapies, immunotherapy, and dedicated pulmonary rehabilitation, they all offer profound, actionable hope to patients and their families. So, we've mapped out the whole shebang: the anatomy, the cellular threats, the diagnostic journey, and the incredible treatments we have today. Knowing all of this, what actionable step are you going to take today to protect your lung health? Will you check your basement for radon? Will you talk to your doctor about a low-dose CT scan for a loved one? The science is here, the roadmap is clear, but the next step, that's entirely up to you. Thanks so much for joining me on this explainer, and keep learning.